Hi, everybody. Thanks for joining me today. This is Dr. Wayne, and my share this evening is about the journey from medicine or medical doctor to healer. When I was about 17 or 16 years old, I made a choice that I wanted to have a career in helping people. I remember my good friend saying it to me at university, Wayne, that was a weird thing to do, is choose to do medicine. You could do anything. You could be a paramedic, you could be a nurse, be anything, but why medicine? I don't know why medicine. It just seemed the logical thing to do at the time. And after getting the grades, I managed to get into med school in Scotland and started the journey of the medical person to become the healer. And it's interesting when you Google the word physician, it actually means healer. And it's also got other names in ancient Greek related to medicine as well. So they're synonymous terms, and especially back in the day of Hippocrates, the word physician and healer was together. These days, I'm not too sure. But I remember back in, just after I finished medical school and I was completed my family practice training in Scotland, I started doing acupuncture. And that was just an obvious next step for me because it sounded like a fun thing to study, and I got into this concept of energy and meridians and healing through acupuncture, an ancient old tradition and practice that created lots of healing results. And I've used that in my practice right through until present day. In my final exam when I was in Scotland in 2000, there was the last question in my 12th question in my paper, and it said, Mark Twain quote, physician, heal thyself, discuss. And I thought this was a trick question, and maybe it was. It was just a practice question at the end, which sometimes they did. But it really got me thinking, and frequently since the time back then to now, I've went back to that question, physician, heal thyself. When we break that down, I think there's a lot of truth in that statement that Mark Twain brought from the Bible. Because when you go to the self, I believe within us, there is a physician and there is healing. So within the self, there is the physician and there is the healer, and hence the statement. And it's been a fascinating journey. And I had an interesting experience just about a year ago, and a patient came in to me and says, do you realize what your name in Scandinavian means? I went, I have no idea. So I Googled it, Dr. or Phimister in Scandinavian means healer. So there you go. Dr. Phimister means healer, healer. Must be something to the quote after all. So that was quite ironic little circumstance and serendipitous moment. Because what I've realized and what I'm flourishing in these days in my career is stepping beyond the principle of chronic disease should be managed. And in my field of helping people with pain, it's a condition that we manage. And I disagree with that. I think we can heal chronic pain. And it's really exciting to hear the terms of epigenetics, which I've talked about many times. And also bringing in words like trauma and also stress. These terms are not synonymous with medical training, and if they are being taught, and they are in small amounts these days, it's not making its way into the general daily practice of medicine, because as you may know, medicine is about a symptom or a collection of symptoms, an examination, investigations, a diagnosis, treatment, and then a prognosis or a plan, a estimated recovery or duration of that condition. And that's what medicine is fundamentally about. And I would say within medicine, there's definitely areas of healing. There's chemotherapy, radiation to kill cancer cells. There's the role of antibiotics, which has revolutionized our practice in the last 70 years since Fleming discovered penicillin. We heal infection. And also in the intensive care unit, if you're very sick, then we give medicines to resuscitate the body medicines to recuperate the body and heal from that life-threatening state. So within the realm of medicine, and surgery is another one, you chop out organs or tissues that are life-threatening. So yes, medicine is about healing. But in the realm of chronic disease, which is based on the inflammatory level at the cell level, then we can heal that too by dealing with inflammatory conditions, which covers, in my belief, in my understanding and research, the source of all chronic disease. You can heal that through food. You can heal it through the mind-body connection, the mind-body-gut connection. You can heal it through external environments like cold showers and breathing. All of these things I do in my daily practice. So, embracing the concept of healer and moving forward, and not just within the physical realm and the mental, emotional realm, but also in the energetic realm, the spiritual realm. And the science is here now with quantum physics, showing the interconnectedness of all of us. And great thought leaders and therapists and medical doctors, chiropractic doctors in the world have clearly shown that healing happens on an energetic level as well. So it's a real joy to be an MD. It's a real privilege to be an MD, and also to wear that concurrent cap of healer, and to know what that means and to live it on a daily basis. So that's a little summary of me. If you want to share this, if this is on YouTube, please share, comment, and subscribe to my channel. If it's on Facebook or Instagram, please make a comment. It's good to see so many people here again tonight. I'll give you a wave there. Hello. It's good to see you. And I hope you like this one, and I look forward to tomorrow when we'll continue to share here live on Facebook. So thanks so much. Take care, and remember, physician, heal thyself.